Hello everyone, I'd like to welcome you to our webinar, How to Implement a Virtual Program for Patient and Public Involvement. My name is Lindell Nerime Prince. I'm the Patient and Public Involvement Manager at the NIHR Academy, and I'd like to introduce you to my co-presenter.
Hi, I'm Esther van Vliet and I work on involvement and engagement for the NIHR School for Primary Care Research and the HPRU in emerging and zoonotic infections.
Thank you, Esther. Before we begin the webinar, we'd like to understand our audience, so a poll will come up. If you can let us know if you are a researcher, a PPI lead, a PPI representative, or if you don't fit into that categories. I'll give you a few seconds to complete that. Okay, thank you for filling that survey. And I can see that majority of our attendees today are researchers, so over 67%. Thank you for attending. Okay, I'll now begin the webinar. These are some of the key points we'll go through today. The importance of virtual PPI, what is virtual PPI, benefits and barriers for virtual PPI, and how to overcome those barriers, and case studies from our researcher and our PPI representative. Okay, expectations of PPI from NIHR. PPI is really at the core of what we do. We support and expect PPI from all the research that we fund. And in the rare cases where proposals do not involve PPI, a clear justification must be provided. So you can see from these 3 points how much NIHR prioritizes PPI in research. I'll now discuss the importance of virtual PPI. We have 3 main points here: digital, COVID-19, and social distancing. We now live more in a digital age, and people are used to using digital technology. And due to the current pandemic and social distancing measures, it's even more important to carry out PPI activities in a virtual environment. NIHR still very much encourages PPI in research during these times. And we've produced a set of 8 commitments to PPI during COVID-19, which are included in resources which will be shared at the end of the webinar. So what is virtual PPI? Before I go into that, I think it's quite important to define what PPI is. NIHR defines PPI in research as research being carried out with or by members of the public rather than to, about, or for them. So you can see it's very much a partnership. PPI in a virtual environment is not a different type of PPI, it's just PPI in a virtual environment and conducting PPI using various virtual platforms. The benefits of virtual PPI. So these are the key benefits we believe are the benefits of virtual PPI. First of all, location doesn't matter. So wherever your PPI representatives are in the country, they can easily attend. They don't have to travel. It's more accessible. People can sort of be a representative from their own home, so they don't really have to sort of arrange about traveling to different locations. It also could be argued there could be a less power dynamics. Very often in the past when I've organized PPI activities, sometimes PPI representatives in the room, there could be some strong characters who could dominate the others as well. So in a virtual environment, this is less likely to happen. There's also flexibility in timing. You don't always have to accommodate travel time, and you could be more flexible in your timing, which leads me on to the last point, is that you don't have to budget for travel and reimburse travel. Next slide, please. Thank you. So I'll now discuss the barriers of virtual PPI. There are several barriers, but these are the key ones we've highlighted today. Poor access to the internet. So this barrier is, for instance, we all know that various internet connections around the country in terms of internet connection being strong in one area and perhaps not the other. So that could be a barrier. Not an access to appropriate devices. So some of your representatives may be in a noisy environment. They may need access to a headset or headphones. That could be another barrier. There could also be technical problems in terms of accessing the different platforms, the platform that you use. Some representatives may be unaware or unwilling to participate digitally. They may be just apprehensive about participating digitally. It also could be less personable. When you meet in a physical environment, you may have a chance to have a coffee and break section, networking. So it could be argued that in a virtual environment, that could be lost. There's also a confidentiality issue. Some representatives may not be comfortable appearing in front of a camera or even showing the surroundings when they are their surroundings when they appear in front of a camera. It also could be less non-verbal communication. Very often when you meet in a physical environment, you're able to read non-verbal cues. That could be lost as well. And there could be an accessibility issue as well. I will now pass you on to my co-presenter, Esther, who will discuss how to overcome these barriers.
Thanks, Linda. So yeah, when we think of poor access to the internet, and I kind of merge it with no appropriate devices, there are several ways how we can overcome this. So really important, and you'll see this coming back with overcoming some of the other barriers as well, is offer options. So some of the virtual platforms will allow you, for instance, to use your telephone and dial into a meeting. Alternative, you could also think of posting people the documents so they can write their feedback, and you can you can get some prepaid envelopes with it so people can return their feedback to you, and avoiding any virtual side of it if they don't have any access to the internet at all. Because you will be likely to have less budget spent on things like catering and travel reimbursements, you might be able to actually provide people with devices or with an internet dongle with a SIM card so they have internet access. You would need to check with your funder whether you are eligible to use your fundings in this way or not. And something to keep in mind as well is accessibility when talking about no appropriate devices. So sometimes, for instance, if somebody's joining from a small smartphone, their device might be too small to actually really use functions within Zoom or other platforms, like they might struggle to actually use a raise hand function or a chat function. So you could think of alternatives there, for instance, waving at a camera or maybe holding a colorful piece of paper to make sure that you draw the attention. And when you think about technical problems, it's really important to allow for testing in advance. So both yourself, make sure that you know the software and you test the software, but also that you allow public contributors to test it, just that they've seen the outset before in case they're not familiar with it. And it can also be an opportunity for you to test if everybody's sound and everybody's camera is working. You might want to consider to just restart the device before you start running your software. Sometimes there is a lot still happening on your laptop or your computer, which might hamper the speed of internet. So restart and shutting everything down except for your meeting gear can help you in avoiding any technical problems as well. It's again about giving people alternatives. So use the dial-in function or other ways to make it a little bit more accessible. And when a technical problem occurs, it can feel quite worrisome, or it can be really frustrating for someone when they are keen to participate in a meeting and suddenly their sound isn't working or their video isn't working as planned. So make sure that you, as the facilitator, make people feel at ease that it's okay, these things happen. It happened to all of us, I think, in the last couple of months. And be sure that you also ask for support. Maybe there is someone from your IT department or a fellow researcher who is able to join you in your PPI meeting and can provide these technical support questions. The first go-to trick is always try leave the meeting and come back in, and sometimes that will already solve a problem. And also be flexible yourself. Know that if a problem happens, if for instance somebody is not able to participate in the raise hands to the camera to ask to speak, make sure that they can, for instance, join via chat function, and make sure that you keep that in mind. Or ask people to be observer to the meeting and then send their feedback to you afterwards via email. Make sure that you have a plan B just in case something goes wrong. Then when somebody is unaware because they don't feel they have the skills to participate, or maybe even unwilling to participate digitally, it's again important to allow for testing for those not comfortable to become more comfortable. And there are various support guides available online as well. These vary from step-by-step guides for various online tools to even videos on YouTube where things are being explained. So there is a lot of resources already developed that can help you in making the software more approachable and accessible to people. Also, in the last couple of months, I think a lot of us have become more used to virtual things, not only in a work context, but also in a private context. So it might be that your public contributors have never joined a virtual meeting, but they might have been to virtual choir rehearsals, had phone calls via the internet with their family members, or maybe joined their local church service virtually. So people might not think of these tools as the same one that you can use for a meeting, but see which ones they are already familiar with, because there might be a tool that you are allowed to use from your university, which is already familiar for the public contributor as well. And again, offer the options. If somebody does not feel comfortable with the internet, see if they're happy to dial in or have conversations via letter writing. Another problem with virtual PPI is that it becomes a bit less personable, because usually there was always this social atmosphere, and feedback has been that people feel that that human connection gets a little bit lost when we move everything virtually. So something to consider is to allow some time before the meeting for some informal chat, like open the virtual room 30 minutes in advance and just see whoever joins. Maybe people will join you earlier, and that will ease the meeting a bit in, because you'll just chat about the weather or whatever really. But just to give that space for people to come and join and have a bit of a conversation, a social moment before you dive into the agenda. It might be good as well, just like we had with our webinar, to have a slide before the start of the meeting, so people are sure that they see a confirmation that they're at the right meeting when they join, that they see the confirmation of the title of your meeting or whatsoever. And be there yourself when the virtual room opens. It might be that a colleague of yours is doing at the administrative side of the meeting, and you are not there yet, but make sure that you are there, because people might come early and have some questions, and it would be good that you're there to answer them in advance. Something to consider at the start of the meeting would be an icebreaker, just something to loosen up, to make the vibe a bit more friendly maybe. So that can be varying from asking a question that people can answer in the chat to some kind of small game using a video camera, or maybe even a small physical activity that you want people to stand up and do a type of exercise just to break it up a little bit. Also try to encourage, where feasible and where people are willing to use the camera, because it can be quite daunting to be in a meeting and not seeing anyone's face and just a lot of black screens. And then a bunch of smiley faces might actually make it more familiar and make it more of a friendly environment. And make sure again that you, as the meeting host, leave the meeting last. Allow for people to stay behind in a way, and maybe they still have some questions they want to ask you afterwards, or check something. Allow people or give people that space to do it. So make sure that in your agenda you plan at least 10 minutes in the end, that you can have a bit of a break yourself, but also that people can ask you a question afterwards if they would want to, that you haven't cut the meeting off. Then when it comes to confidentiality in virtual meetings, a lot of the virtual platforms have the option to hide the background, like we have with our NIHR background at the moment. So make sure that you make your contributors aware of how to do it, and or maybe do it yourself as well, in case you don't want to show everyone, especially your home environment. Also make sure that you address confidentiality in advance and at the start of the meeting. And that goes a bit two ways, because you might be sharing research data that's still very much confidential. But at the same time, public contributors might be sharing their story or their experience, which they consider confidential as well. So it's good that everybody is aware of the confidentiality, really, of the conversations that you are having. Also try to encourage people to join from a private place or a workplace where the room is there. If people have a spare room where they can sit away from partners or spouses or flatmates, encourage people to have their own space during these meetings, and make sure that you make use of headphones or simply earplugs, just to be sure that if someone else is in your in where you are or where the public contributors are, if they have any flatmates or partners with them, that the only thing they hear is your response and your answers, and not anything that anyone else in the group is contributing. So when we think about communication, it's more than just the words you say. There is such a big element in communication which comes from non-verbal communication. So it's about what you say, whether you smile or how you look. And this can get a bit lost with a virtual meeting, maybe because the camera doesn't really work, or there are so many people in a meeting that you can't keep an eye on everyone's faces. And this could cause situations which you want to avoid. Like if somebody asks something in the chat, if they would say it, you might have a nice friendly face with it, and people would know to not take it maybe too personally. But written in a chat form, it can maybe be interpreted in a way that you don't want it to be interpreted. So raise awareness at the beginning of the meeting that these things can happen, and that we're all here in good faith. And I think it's important to just address it, and also again give options, because it can be that during a meeting in a room, you would see if somebody gets a bit agitated, or you would see when somebody wants to contribute but they can't, or they can't get in between, or they struggle to make their point, to get their point across. So give people options with, for instance, raising their hand or showing a colorful piece of paper to give them ways of how they can express themselves. And also again, ask for support. So if you have a colleague joining you, ask them if they can keep an eye on the participants as well, just to see, is everyone still looking comfortable? Does everyone still seem okay with the meeting so far? And then the last barrier to think about is accessibility. So there are some things you need to keep in mind with planning and conducting a virtual meeting to ensure that it's accessible. First of all, ask people. Ask people if they have anything, or if there is anything that you can do as organizer of the meeting to make it more accessible to them, because people will know their own needs and they will know what can help them to make the meeting more accessible. Things you can considering are live captioning. So there are various, some video platforms already offer it. With others, you can use external software such as Otter AI to have live captioning during your meeting. Also keep color usage and font in mind, for instance, for people who are colorblind, or people with dyslexia, that they struggle reading, and some fonts might be more friendly for them than others. You could also consider having a translator in your meeting as well. This can be a translator into a foreign language. It can also be the British Sign Language translator, so that your meeting becomes more accessible for people who are hard of hearing. And you could also consider to completely lose visual support, so make it a fully verbal conversation, especially when thinking about people who have trouble seeing. If you would level the playing field if you would just do everything verbally, and nobody would feel left out because they might struggle to see the slides. So that will bring us to our first case study, which is from Ben Wills-Eve, who is a PPI representative for the NIHR Academy, and he will share with you his experience of being involved virtually. Ben, over to you.
Thanks, Esther. Yeah, so I've been a PPI rep on various panels, both at NIHR and at different universities for 5 or 6 years now. Even before we've had all this change of interaction with COVID, etc., on some PPI panels, we still had quite a bit of virtual PPI 2 or 3, 4 years ago. And that was primarily around teleconferences. So you'd have to phone in to a meeting where there'd be people already in the meeting, and you'd be sat there at home on your phone, hearing only about half of the meeting. So in some ways, this introduction of Zoom and Teams and these different platforms have made that quite a bit easier to navigate. So even if you don't have access to the internet, you could still phone into the meeting, but the audio quality is so much better on average. You can actually follow along to the meeting and be involved. I can think of one example where it can differ with different types of PPI meetings, but if you find yourself as the first or second PPI member in, say, a large steering group meeting, which happens quite a bit, and there are 10 or 20 other participants, when you're phoning into a meeting like that and the audio quality is poor, it's almost impossible to contribute. Whereas now, if you're contributing online through Zoom, or if you're just phoning into a Zoom meeting, you can still see everyone else there, and it's actually still quite easy to contribute. So that's definitely an improvement on how things used to work. I saw a question pop up about power dynamics in virtual PPI meetings. It's an interesting one. I think it's different, but they can still exist. But there are definitely things you can do to mitigate against this. So for instance, I've found, again, it depends on the type of PPI meeting. If you're doing a research-based PPI meeting where the majority of the participants are other PPI members, it can be less of an issue if you've got a chair who is experienced and also used to the platform. And say it's important to make sure that if you're a researcher who's going to be doing a lot of PPI meeting chairing, you need to make sure you're well versed in the platform before you start. However, if it's another of these steering group meeting type affairs where you have 1 or 2 PPI members on the panel and lots of the professionals, what can happen is that a lot of sometimes quite technical documents get shared beforehand. And even if you do all your prep and read them thoroughly, during the meeting, if you have a 20-minute PowerPoint presentation about some detailed stats to do with the research study that you're involved with, it can be extremely hard after that 20-minute gap to then come back in and say, well, actually, have you thought about this? Have you thought about that? Whereas in a face-to-face meeting, you could stick your hand up and say, don't really understand this bit, but please can you explain how it relates to this part of your project from a public perspective? So I think those two things are still important to bear in mind, although it can still be more democratic on these platforms in terms of making sure people are muted, having one person having better control of the whole room. If it's heavily reliant on other information beforehand or detailed information which is being presented and there's no opportunity to be involved during the presentation, that can also be difficult to then navigate afterwards. So I think there's a mixture. It's definitely a big positive in terms of what's possible virtually now compared to how it used to be, even just on the phone. But I'd say some of the problems that have always existed to an extent in some of these PPI meetings will still happen, just in a different way. And it's a case of planning ahead and thinking, I have got a really long technical presentation. How can I make sure that the PPI members have got a chance to ask questions during the presentation and make sure they understand it all? Now, the chat can be a good option for that, but again, on different devices, it can be harder to access the chat. I think sometimes on a mobile device, it's tricky to use the chat and see the presentation. So that's something you'd have to work out beforehand. But that's my experience so far, and I'll now pass you on to Beth, who's going to give you the experience from a researcher's point of view.
Hello. So hopefully you can hear me. Fabulous. I'm Dr. Beth Bareham, and I'm based at Newcastle University. And my research is around promoting healthier alcohol use amongst older people. And currently I'm on a one-year NIHR School for Primary Care Research Fellowship to co-design an intervention to support older people in primary care settings to make healthy decisions with their drinking. And I'm hoping to apply for some funding from the NIHR Advanced Career Fellowship to pilot this intervention moving forwards. So patient and public involvement is really, really central to my work this year. So you can imagine that I was completely thrilled when my first workshop was cancelled due to coronavirus in March. And, you know, things just got more exciting from there, didn't they, really? So I've been adapting to online PPI this year. And this started with a lot of time spent worrying about the changes to my plans, dragging my feet, not wanting to get started, but waiting to hear what others' experiences and approaches were. For me particularly, I was really, really concerned about my older target group who are particularly vulnerable to coronavirus. And I felt they probably had bigger things to worry about than my research project. But I knew that this was really, really important for my work and my career moving forwards. I also had some concerns around older people's access to technology as well. I don't think the older age group is particularly well known for their tech access. So I focused on paper writing for the first 6 months and attended a lot of webinars like this one to make me feel a bit more confident about it. And then I bit the bullet in August this year. So I've been running my workshops on Zoom, which most of my contributors are completely, well, all of them are completely happy with it. I know there were some issues and concerns about that at the start of the year. And I try to do a session for each group. I've got 2 different contributor groups, and I do a session per month for each of them to try and get going with this co-design work. So I have 2 quite manageably sized groups. I saw in the questions and answers people asking about muting and things. I try to make sure that everybody is talking at the same time, and it is really kind of like an intimate discussion. So I've got 7 older adults who have lived experience of alcohol dependence and treatment, and 5 older people with lived experience of drinking as an older person, but not at a dependent level and not having access to treatment. I've been quite lucky because most of my contributors already, I had an established relationship with them through previous involvement work with them, through my research, but also through my role as an embedded researcher at one of my partner organisations, Drinkwise Age Well. So these groups have a lot of patience with me, these individuals. They know me really well, they know what I'm like. And having that relationship with those individuals means that for people that don't know me who get involved in the calls, they've got to know me really well, really quickly, and picked up on that rapport as well. So that's been fantastic. They're also involved in broader patient and public involvement and activism organisations. And these organisations have been really keen to get them online since March. So before I got to them, they had a lot of tech support and a lot of tech provision. And this is including individuals from really deprived areas as well, particularly those service users of Drinkwise. They're from very deprived areas. So it was really, really great that they were set up before me, but I had been kind of envisaging that I might need to look into tech support as well. But you know, as it happened, I was worrying about nothing really. And you know, they've got to this point, they're quite tech savvy, and they even do things like reminding me to press record, which I forget to do quite a lot. So they keep me right, really. They're more tech savvy than me quite often. I also know some people who were less fortunate than me, but have been really, really successful and committed, like Rima Cardle, who I think is in this call at the moment, who've set up new groups online of contributors during coronavirus. So she's been researching with people with dementia and carers of people with dementia. So it seems that this is also very possible as well. I think, you know, like I say, the reservations were a key theme in my experience of PPI, but they've all been challenged so far. So like I say, yeah, my preconceptions have been really, really challenged through my experiences. And I think the issues that my involvement contributors are interested in, that I'm researching, they don't just go away. I put in a coronavirus funding bid in August with their input, and it was very interesting, but also incredibly sad to hear their experiences of how coronavirus had affected the people around them and their alcohol use as well. And this really reinforced to me that coronavirus, if anything, had made my topic all the more relevant. And I think, you know, it's the case for most of our research topics. These issues don't exist in a vacuum, and coronavirus will be creating challenges for all of this and kind of, you know, emphasizing the importance of supporting people through our work. So I tend to schedule 3 hours for my sessions in these workshops, but we usually finish early. Zoom fatigue is an odd and very real phenomenon, I think, and where we previously would have managed full days of interactions together and having a great time, we're all getting very visibly tired after 2 hours, and we never get through the whole agenda. And I think this highlights the importance of having, you know, a longer term program, and it's really even more important given the significant workload involved in co-designing an intervention. So making sure not to have too ambitious expectations for individual settings, and also ensuring lots of time to get people logged on. I don't think that's unique to the older age group. You know, I'm often late for Zoom meetings too. Hopefully not my own usually. So I try to ensure that phone-in is enabled as well if people are having tech issues, and in the right country. So I'm a repeat offender for having Zoom enabled in the US instead of the UK, which is a particular gripe that my contributors have with me when it all goes pear-shaped. But it seems, you know, they keep me right as well. And also having the flexibility to catch up with people in extra sessions too, if they're unable to get logged in as well, to get their input and keep them involved, I think is really important. So I've talked a lot about how I've adapted to the online environment, but there's a few quirks attached to it as well. So this is an example of an adaptation. So I'd usually use a flip chart in the office to map key issues that we're talking about. But I wanted to highlight today, because I only discovered this last month, there's the whiteboard function on Zoom that I'd never noticed, where you can turn your screen into a screen share or a whiteboard, and you can all kind of contribute to that and have this visual to support your discussion. So that's been really fantastic. So have Zoom recordings. So being able to view the session afterwards and make notes has been really helpful for my work in intervention design, and having that on playback in my living room so I can sit there and do that design work on my sofa. It's also useful, particularly for co-design, where I've got these recorded experiences that can be used to instigate discussion in later sessions where I'm hoping to involve practitioners in my work. So just to finish with a few reflections, I think I have emphasised that, you know, there are challenges attached to doing this work online. Certainly, I've highlighted that it was something that I was very phobic of, particularly with my preconceptions about older people's priorities right now, and also their access to tech and ability to use it. But obviously that's been very challenged through my experiences. But I think also we need to acknowledge the mental load of doing this work online in such an odd environment, and particularly for me, where I was ramping up my patient and public involvement work. Some of my colleagues, so for example, Laura Boy, who's also on this call, have been writing up reflections on each of the sessions, each of their sessions, because it's a new way of working and considering what to change between sessions. And I think this is a really great and useful approach for fine-tuning and getting the most out of the interactions. But there's also some advantages. I've highlighted many, for example, in involving people with really, really relevant experiences from across the country has been something really key to me. Some of my people with a lived experience of alcohol dependence are from all over the places, and it's been saving me a lot of travel time. My contributors also have very high availability at the moment because lots of us are in areas with local lockdown measures, so not a lot of us have an awful lot to do on our agendas aside from talking to each other. So that's been quite useful. And I suppose just acknowledging that, you know, I've managed to adapt a very significant piece of patient and public involvement to online working, I think is, you know, an achievement in itself. So if I'm to offer any advice, I would say just bite the bullet. Reach out to your contributor groups, organise a session so that you've got a no escape, and get set up for that, because I think the preconceptions that you might have about it will be challenged. But if anyone wants any top tips, there's a really great blog that one of my colleagues put together that I'm going to paste into the chat box as well. So that's me. Thank you so much.
Thank you, Dr. Beth Bayham, and that's really useful to gain a researcher's perspective. And also thank you to Ben Willis-Eve for him bringing a PPI representative perspective as well. So in this section, I'm going to discuss how you could go about finding PPI representatives. There are many avenues where you can find PPI representatives. There's the People in Research. This is a website which provides opportunities for public involvement. Researchers can place opportunities on the website to find members of the public who want to be involved in research, and members of the public can look for opportunities to be involved in research on this website. We'll also place links to this website at the end of the webinar. You could use social media. There are various platforms out there that you could use. All I would advise that you select the appropriate social media in terms of the PPI representative that you want to target. So for instance, if it's a social media popular with younger people, you select that. If that's the PPI representative you want to target, that group. There's also NHS clinical commissioning groups known as CCGs. So local CCGs hold network meetings where some members of each patient participation group's network can meet. So you can contact your local CCG, the engagement office or the engagement officer, who may be able to put you in contact with their PPG members. There's also NHS Trust. You can contact the membership office or membership and engagement officer, who may be able to put you with their members who are made up of local people. We have universities. Some universities may have an involvement team who can link you up with students who may be interested in being involved in your research. They also have charities. Charities often have membership, which include members of the public, and they may be able to put you in contact with their members. It would just be useful to contact the charity that relates to your research. So I'll now pass you on to my co-presenter, Esther.
Thank you, Linda. So I just wanted to highlight a few things which are important when thinking about facilitating PPI meetings. So first of all, remember that PPI contributors do this kind of in their spare time. So make sure you send the documents well in advance so they can plan preparing for your meeting beyond their own work and social commitments. And at the start of the meeting, think about setting the scene. This is a great way to address things like confidentiality, but also make sure to address that everybody's opinion is valued equally. And it might also be a place where you want to identify as a group the purpose of the meeting that you're in and why you are here as a group and what you hope to get out of it. As a facilitator, be sure that you are impartial, because you organize this PPI meeting to really hear what people have to say. And the added value really of PPI is also that they come with an experience that you might not have as a researcher. So try to be impartial and let people tell their story. And also manage expectations. It very much depends on which stage of the research you are, what the difference is that PPI contributors can bring to your research. So for instance, if you've already done your whole data collection, it doesn't make sense to discuss your research topic on Zeek, because you might not be able to make any changes there anymore. During a PPI meeting, people will be sharing their stories, and it could happen that somebody starts telling a story which is completely not related to the aim and the purpose of the meeting that you've set in the beginning. This can be quite frustrating for you as a facilitator, but also for other participants in the meeting. So make sure if something like that happens, that you try to interrupt people to bring it back to the topic. So you can, for instance, thank the person for their contribution, remind them that we're here for a specific discussion, and then lead it back to that subject. And make sure that everyone feels heard, because everybody in your meeting is there because they're interested in your topic and they want to contribute. So some people might be more proactive in coming forward and giving their feedback, and others you might have to ask them or invite them to give their opinion as well. And when we move virtually, there are a few other things to keep in mind when facilitating these meetings. First of all, there is a lot happening. With a Zoom or any of the platforms, you might have to share your screen, keep an eye on the chat, try to manage people raising their hands. It's a lot. Don't try to do everything yourself. As mentioned earlier, see if there is somebody who can help you with, for instance, chat facilitation and technical questions or technical problems that people might have. And also try to limit distractions. Because you're behind your computer, it's really easy to keep your mail open and work things pop up, or your phone might be buzzing. Try where you can to limit distractions, and also ask your participants to, for instance, turn their phone off or put it away or turn off their email, so everybody can focus on the meeting that's happening right there. As I said, technical problems can happen. So as a facilitator, be sure that you're comfortable with it, and that you are familiar with the software. So if something happens, you can offer alternatives to people, and you are familiar with the alternatives that people might be using as well. And as Beth said, Zoom fatigue is a thing. I think a lot of us will have experience of it in the last couple of months. So consider the length of your meeting. Whereas you maybe used to do half a day, you might want to shorten the meeting, or you might want to cut it in shorter pieces, spread over different days. Because by shortening the meeting, you also have a chance of losing some of the richness which you could otherwise have from a PPI meeting. And make sure that you schedule breaks as well, enough breaks within the meeting to cut things up a bit, to let people leave the screen or just have a brief walk around the house. And as a chair, you might need to take a bit more of a leading role, because it's quite easy with virtual meetings that people interrupt each other unintentionally, or people might feel awkward to interrupt anyone. So make sure that if it's needed within the setting of the meeting, that you take a more proactive role, and be flexible in this as well, because you don't know what's going to happen. So as a facilitator, see what the needs are of the group and see how you can best facilitate that in a virtual environment. So at the end of the day, as we said in the beginning, virtual PPI is not a different type of PPI. It's just a different way of conducting PPI. And we would really like you to think of your audience when you're thinking of your PPI, and discuss with them what would work best. So we've got, see it as this whole spectrum of in-person PPI and virtual PPI and everything in between, and mix and match really, and decide what works for you and how you can shape a PPI program for your research, which meets your research, it meets the needs of the PPI contributor and the resources that you have available to make most of it. So that was our webinar, and now over to Linda, who will be hosting the Q&A.
Thank you, Esther. Thank you for that. But before we go into the Q&A, I would like to sort of bring up the opportunity to complete a poll. Earlier on the webinar, we discussed what is your favorite benefit of virtual PPI. So if you can complete that, and I'll just give you a few seconds, and I will discuss the results. Okay, thank you for completing that. I can see overwhelming majority, 66%, said location doesn't matter. I think this is really quite useful. It means that more people can get involved. They don't, again, have to travel and be aware of making travel arrangements. So location is very key in terms, and I think you can, like I said, attract a wider audience. So thank you for feeling that. So in this Q&A section, you will have the opportunity to post questions to all four of us. So myself, Esther, Dr. Beth Berman, and Ben Willis-Eve. And any question that cannot be answered today, you also have the opportunity after the webinar to complete a survey, and we have an email address, and if you send your question there, and we will get back to you. So yes, please, I think I need to go to the Q&A section. Okay, so the first question we have, what about digital poverty? I know we need to engage digitally at the moment, But digital poverty means it's also inaccessible and less inclusive, which we need to be mindful of. Any suggestions how we try to readdress this balance? So I'll come in, but if I can go to Esther first.
Yeah, so it's a bit what I tried to address during a presentation. So yes, it's definitely a thing, and not everybody is online or has the access to the devices. But for instance, see what your budget allows you to, for instance, provide people with a tablet or provide people with an internet dongle or something like that, or compensate them for their internet usage as well, that people can, for instance, afford a higher internet on their mobile phone and then use their mobile phone as a hotspot or use their internet from their phone. So see where you can work with compensating people a bit more who might need it. Alternatively, some places like are starting to open up, very much depending, of course, where you are in the country. But for instance, some libraries are starting to open up, so maybe people are able to at least have access to email by going to these kind of venues again.
Thank you, Esther. Yes, I'd like to second that. You know, I think there's always this presumption that everyone now has access to, yes, people are more being digitally enabled and in terms of used to using digital technology, but not everyone has access to digital equipment. So just be mindful of that. But I like the idea you said, Esther, about libraries, but obviously just be aware of current social distancing measures. Beth and Ben, I don't know if you want to add any more to this point. No?
No, I think Esther's got it, sorry.
Okay, okay, no problem. Thank you, Esther. So the next question, discussions can be difficult in virtual meetings as everyone has and needs to have their mic muted. What is the best way to get rich discussions in virtual PPI meetings? Yes, I agree that everyone could have their mics muted, but sometimes I actually think that in a virtual environment, because I've been in a physical environment and everyone can be talking and interrupting others. So I think that you may be able to even have a richer discussion because everyone gives a chance for the other person to speak, you know, when microphones are muted. So I personally think that you can have a richer discussion and not be limited, whereas in a physical environment, sometimes people always interrupt each other or can interrupt each other. So I don't know if anyone wants to add to this.
Yeah.
Yeah.
So I think I highlighted in my talk, I don't mute any of my participants, and if I think that some of them are struggling to get a word in, we use the hands up function, which is really useful. Or if they can't find the button, then they just put their hand up for me like that. And I just try and facilitate them in through that, which seems to work. But like I say, I tend to work in quite small groups, and I think at Newcastle, certainly the people around me also work in that way, just with the smaller groups.
Okay, thank you, Beth.
Something to maybe keep in mind as well is that there are, like for instance, what Beth said with the whiteboard, or there are external websites which will allow you to in real time put post-its on visible for everyone. So in that way, everybody can contribute with written things like a post-it at the same time. So then you can, in a short amount of time, get a rich amount of data from people, and then later on, maybe in a more structured way, discuss the post-it contributions that everyone has given. So that will allow real-time, multiple, maybe even chaotic feed in, but then you can facilitate these discussions again to be a bit more structured.
It's good. Ben, did you want to come in?
Yeah, so I think sometimes in the bigger meetings, this can be more of an issue. In the smaller meetings, it's usually not too bad. I'd say the best way of doing it is that if people are comfortable using the chat and can find the chat, which isn't always the case, then having maybe, whether it's you or maybe a co-facilitator whose main role is to kind of stick on the chat and see what's happening, and maybe being able to answer their questions in real time while the presentation's still going on, that could be really helpful. Otherwise, you can get to the end of some of these presentations and feel completely lost.
Thank you for that. That's quite, those are quite useful points. Thank you. So the next question, are there any protocols for virtual PPI with children and adolescents, or any advice that you can offer?
So something maybe to look into is the white pack groups. So these are young people involvement groups that are spread throughout the country, and they have provided several blogs and resources recently as well, where they share their experience of how they've been running virtual groups online. When we talk about involvement with a younger age group, there are of course a bit more concerns around safeguarding and making sure that you're providing the right atmosphere and the right place for people to involve. So it might be a nice one to see what they are doing and learn from their experiences, because I know they have been having their meetings and been sharing reportings on how they went and what kind of tips and tricks they've been using.
Thank you. Thank you, Esther. That's a very, very valid point. And there's a next question, which actually I feel it's been answered from the response that you've given. So I'll go on to the one after that. Do you have any tips for trying to engage with new PPI contributors in a virtual way? I don't know if Ben may want to, I don't know if you have any points with that, so I'll now come in.
Yeah, I think, well, some of this goes back to Esther's last point about young people's groups, etc. There are existing PPI groups who already do everything virtually by default. And I think often these have come about because different people in different parts of the country have either met on social media, or they've formed a Facebook group, or they've been in touch with a charity who's then formed a Facebook group for them. So I think your best bet is probably to look at a charity in your research area and say, do you know of any online support groups already exist, or have you got any tips for how we could set something like that up for PPI and research? And otherwise, if you're active on social media, it's always worth starting to put messages out on there and seeing who else is active in that area, because they're often the sort of people who want to be involved anyway.
Thank you, Ben. Anybody with any more comments on this point? Okay, I'll go on to the next point. Can virtual Can virtual meetings be recorded, and how to proceed with that within GDPR? I would always say, in terms of advice for this, is always get the consent of your representatives, so whoever is attending that meeting, that you make sure that you have their consent first before you go ahead with recording. But I just wanted to ask if anyone wants to add to that point.
Also check your university policy, because universities very much differ in which software they allow you to use and which softwares they allow you to use for recording. So there are recording softwares that will save your recordings locally on your device, which might be a safer option than using wider recording software where they are stored elsewhere on a browser, and then it can get dodgy, especially with GDPR if they are based outside of the EU. So the best thing might be to check with the IT officer or the GDPR, the person who is responsible for that within your department or university, because they can advise you what is your university policy.
Okay, thank you, Esther, for that. I have the next question, which is for Beth. Can you share your experience of initiating contact with PPI members virtually in the recruitment process? Did you recruit virtually?
Is that for me, or yeah, for me?
Yeah.
So I recruited through 2 organisations that I was already very well attached to, and I had I suppose to the point of personal working relationships with a lot of the contributors that I have in my co-design group. So like I say, I was quite lucky with that. But the organisations did help me to broaden the groups as well. And I was in touch with the coordinators from those groups. I know that Rima Cardle, who I think is in the audience at the moment, she did a lot of work to engage with people virtually, and she might be able to share that in the chat box, how she got them involved with that work.
Thank you, Beth. Okay, I have a question here. Why would a virtual environment lead to less power dynamics? So do you want to pick up this one?
Yeah, so some of the feedback that we've gotten over the last couple of months. So power dynamics is known as a barrier within PPI, and that's especially when you think of people in a meeting where everybody is the Professor XYZ of the University of B, and you're the PPI contributor. when all these meetings started to move virtually, people were suddenly in their own home. And usually titles are being dropped when we think of our names as well. We'll just say Esther or Esther van Vliet. And the whole list of titles are kind of dropped when we have a meeting virtually. And being in your home environment, maybe being disturbed, Professor X is being disturbed by his cat, and you've got a dog barking in the back. It's these kind of things that make it feel more, maybe not human, but it makes it more feel like, oh wait, you're a professor, but you also have a cat. That's okay. It's these kind of barriers of especially hierarchy that are felt sometimes in the past, and that we got feedback that people felt them less when these meetings have happened virtually.
Thank you. I think that's a very important point. Anybody would like to add more to that point?
I suppose the like the Zoom environment, you know, the interrupting thing is a lot more obvious, and I think it kind of encourages you to give the person space to finish what they were saying. And also, like I say, the hands up function as well, because there's a button for that, and it's like part of Zoom etiquette. I think helps people who want to get their opinion in, but maybe are being talked over. It helps me to facilitate them in.
Thank you. I have not a question, but I think this is quite useful to mention from an attendee. Not a question, just to reflect that as a patient contributor, I found it really helpful to have the option of being heard by being able to send comments in later where it has not been so easy to break into a virtual conversation, but that has been fine where the input later has been acknowledged. I think that's very important because, like I said, some people may not be confident at that time to make a comment, just like if you were in a physical room. So to be able to have that option to send information later is important. Anyone would like to add to that comment? Ben?
Yeah, I'd say on that as well. The chat function can be quite useful on that, well, especially on Zoom. If you're getting lost in something which is being discussed, it is quite handy to be able to chat, and then someone else might be able to explain it to you while the discussion's still going on, without having to unmute or dive in. So that can be really helpful. We found that in other settings as well, and really useful for some people.
Thank you. Okay. So this is another one I think is quite useful to highlight, but access to the internet could be a problem for some PPI groups, especially if they are made up to represent the views of deprived or underserved areas in urban cities or rural areas. How to solve this issue? Yeah, this is always a tricky issue in terms of internet problems. Does anyone, maybe from a PPI perspective, or Esther, I mean, it's one of those issues whereby, as Esther mentioned, you know, if possible, obviously adhering to social distancing, some people can still sort of access the internet through libraries, but again, depending on the social distancing rules in your area. But yeah, that is a valid question. That is a valid comment, that underserved areas or urban, or people in urban cities or rural areas may have an issue with that. Anyone want to add to this comment?
I was just going to quickly say, I know that some people working in PPI do so involving patients and the public in their research at the moment are engaging people without internet access via the post. So sending out documents and having kind of letter exchanges. It's maybe like old fashioned and an effort, but it seems to help people get involved. But I think certainly in my project there have been casualties to not being connected digitally as well. As one of my people with lived experience of alcohol dependence who I knew really well up in Glasgow, living in a very deprived area, who doesn't have a phone or internet, who I haven't heard from at all, even though I know she's in touch with some of the other contributors. So yeah, it is a shame, but hopefully when we're back face to face, I can bring it back in on what I'm doing.
Okay, thank you for that. So the next question I have, could PPI groups be done through forums, WhatsApp groups, etc., instead of having everyone talk at the same time? Maybe both options could be available.
Yeah, so I mean, we've now kind of focused here on doing PPI via a virtual video platform, but there are other ways. As you say, there have been cases where people set up an online forum and use this online forum or Slack or things like that to communicate and to get input and get discussion. It doesn't have to be via a Zoom or a Teams or something like that. There are loads of different ways. So something like a forum or WhatsApp group, but WhatsApp, keep again GDPR in mind because people will see each other's telephone numbers. So you need to be sure that everybody is happy with that. But there are alternative ways to keep in contact and have rich discussions which don't involve video platforming as well.
Thank you, Esther. Anyone want to add to that comment? Ben?
Yeah, yeah, along the same sort of lines, private Facebook groups can work in this way. They're not commonly used for kind of structured PPI meetings, but quite often you'll get a PPI community for a certain project on a private Facebook group. And that can be really helpful for keeping everyone involved in the gaps between meetings, which can be quite tricky sometimes, but they can work well.
Thank you for that. Okay, for the next one, could you offer any further comments about the use of creative approaches such as graphics, narratives, particularly in terms of virtual engagement and participation do's and don'ts? Beth, perhaps do you want to comment on this?
So creative approaches, is that kind of techniques that people are using to get? So I've been trying to do a bit of evidence-based co-design to start off my work with people with lived experience of alcohol dependence, and kind of drawing on my qual interview kind of expertise, I suppose you would call it. I hate saying that word. I've been doing kind of like timeline work with them around their experiences of alcohol dependence and how they've been supported in their lives. I tend to try and do most of my stuff kind of face-to-face in a conversation format with my older adults, probably because of my preconceptions about tech savviness, and maybe my own limitations as well. We get as far as using the whiteboard, but I know colleagues that are working with younger people. I think, was it Esther mentioned the post-it note kind of applications that you can use online? Apparently they're getting more contributions through post-it notes than like they would get in their face-to-face interactions, and people who usually quite are contributing because it's you know, more anonymous, doing it through the post-it note function. So they're planning on continuing that after they're not even online when we're face-to-face again. So
thank you. Anyone else wants to add to that comment? Or
no, just what I want to say is try things out as well. As Beth said, like it might be a hurdle, but if you say like, I'm going to try something with you guys and we're going to see if it works, and if it doesn't work, we're going to learn from it. And if it works, we found a great new way to do PPI. Don't be afraid to make a mistake. It's okay. Everyone makes mistakes, and PPI contributors won't be angry at you if your tech fails or if something doesn't go perfect.
thank you, Esther. I'm just going to, I know we're running out of time, so this will probably be the last question. Is it possible to conduct PPI by telephone if people are comfortable with online platforms or have little digital literacy? I would say yes, actually, because even in online platforms, some people actually dialing rather than go on using the internet. So I would say yes, it is. But I don't know if anyone wants to add to that comment.
Yeah, my colleague Ree, she has done she's involved most of her patients in the public on via individual telephone calls. I think she works with people with caring responsibilities and with cognitive impairment. So being able to, you know, give them that attention on a one-to-one basis, I think she's found really useful and, you know, better for that target group.
Thank you. Anyone else?
Maybe something to keep in mind, if you know people will be joining via telephone, maybe you can email or post them a copy of your slides in advance, because they won't, of course, see the screen when they're dialing in. So in that way, they can still have the full visual experience as well of what you will be sharing in your slides, or make sure that you talk through everything that is shown on your slides in detail so that they won't feel left out because they are on the phone.
Thank you so much. Thank you, everyone. I know that there's still lots of questions to answer, but we're running out of time. So I want to really thank everyone for participating today. I'd also like to highlight there'll be a survey that you complete at the end of the webinar. Please kindly complete this survey. It really enables us to improve webinars in the future. And also there'll be an email address. So any question that wasn't answered today, please send that that question to that email address. I'd like to thank my co-presenter, Esther, who's very instrumental in putting this webinar together. So I really thank her for her insight. I'd also like to thank Dr. Beth Burham for bringing your insight in terms of a researcher. I'd also like to thank Ben Willis-Eves as a PPI representative. I've worked closely with Ben in the past, so thank you, Ben, for being part of this webinar. And I'd like to thank everyone for attending. Thank you so much.